my name is Morgan Duval. I am a doctor of physical therapy, and today I'm going to be taking you through a few standing exercises for functional abdominal engagement. So you will need a TheraBand for this exercise, and the one that I have is pretty long, and what I've done is I've actually tied a knot in the middle of the TheraBand. And the reason for that is because I'm going to open my door here. I'm going to toss the knot over the top of the door so the knot's on the other side. Then I'm going to close the door, and now as you can see I have two TheraBand ends coming down from the door. Now these are not exactly the same length because I didn't really do a great job tying my knot in the middle, and that's okay. I'm just going to grab them at the same length. So you'll see the one over here in my left hand is a little bit longer than the one on my right hand, but I have the same resistance on both. Now for this exercise, you'll stand with your feet a little more than hip distance apart. Take a teeny tiny bend in your knees. This is not a squat, it's just a tiny micro bend in your knees. Engage your abdominals, so squeeze your belly button towards your spine and hold that engagement. Do not let go. Engage your glutes. Gentle squeeze of the glutes. You should feel your tailbone pointing directly down towards the ground. Now maintain the strong stance. Grab your TheraBand and very gently pull your TheraBand down, straight elbows, straight arms. Your hands are coming to your hips. Then slowly release. Do it again, and you should actually feel your abdominals firing a little bit more as you pull down. Your arms will be working here, but this is really more about the abdominals than the arms. And if you're not feeling it, try grabbing a little bit higher on the TheraBand, and don't worry about pulling your arms all the way down to your hips. This is not about the arms. This is not about how far down can you get your arms towards your hips. This is about squeezing your belly and using the downward pressure of your arms to engage your abdominals a little bit more. It's almost like a bad 80s dance move. That's what I think about when I do this one, right? So hips come forwards just a little bit, squeeze the belly and pull. Okay, so that's exercise number one. The focus of this exercise is really to fire your core and your glutes in this strong, stable position. The next exercise we are going to do looks very similar, but it's very different based on how you're engaging your muscles. So for the next exercise, you'll take your bands and you're actually going to wrap them around the outsides of your hands so that your palms are facing forwards. And once again, you want them to be about the same length. I just had to make the one on my left hand a little bit longer of a tail because my TheraBands are not quite the same length here. So palms are going to face forwards. While I do want you to engage your abdominals and your glutes here, this is going to be more about your shoulder blades and opening up through your chest. So for this exercise, squeeze your belly button towards your spine, squeeze your glutes, legs are still about hip distance apart, maybe a little wider with a micro bend in your knees. Now what I want you to do is pull your straight arms down. Doesn't have to be all the way to your hips, but as much as you can tolerate. Now squeeze your shoulder blades and stick out your chest. You should feel the muscles in between your shoulder blades firing more than anything here, and it should feel like you're doing a chest bump a little bit, all right? And you're gonna release, and again, squeeze. Now here's what this is not. Watch my shoulder carefully. This is not arm behind your back, head of the shoulder forwards. I want this motion to start with your shoulders going backwards. Elbows should actually stay in front of your body. They should never be coming behind like this. So elbows in front of your body, shoulders pull backwards, squeeze your core, squeeze your glutes, lift from your chest as you chest bump your door a little bit, okay? So you'll relax and pull. This is a lot more focused on your posterior chain strength in between the shoulder blades than it is directly on your abdominals, but both of these exercises are fantastic for proper postural awareness and control. All right, done with those ones. Most people do about 2 to 3 sets of 8 to 12 reps with these exercises. I say as many as you can do with perfect form and no symptoms is how many you're gonna do. 2 to 3 sets of 8 to 12 reps is a good starting place though. Oh, there is my band. So next exercise, you're gonna take the band off of the top of the door. You will open your door and loop the band around the doorknob on the other side. Then you will very securely close your door on the band. Make sure it's secure. Make sure that door is not gonna pull open on you, okay? With both ends of the band in your hands, you'll turn so that you are facing away from the door. You'll grab the band with both hands and bring it right in front of your sternum. It's not touching your chest. You have about 6 inches to a foot in front of your sternum with the band here. Then I want you to step away from the door until you feel that band starting to pull. It's going to try to pull you back to that rig point. Don't let it. So keep your hands directly in front of your sternum. Engage your abdominals, squeeze your glutes. You should really feel your abdominals starting to fire here as they prevent that rotation back towards the door. If you can't quite feel them, step away a little bit more until you can. Now, once you've found your edge where you really feel those abdominals firing, you'll slowly straighten your elbows, keeping your hands in the same plane as your sternum, and then bring your hands back to baseline. All right, we'll go forwards and backwards about 10 times here, continuing to squeeze your belly towards your spine so that you get a nice, firm abdominal engagement. After you do about 10 reps here, you'll turn around and do the exact same thing on the other side so that you can work the obliques on the other side as well. Now, after you've completed this on both sides, you will actually take both ends of the band into your hand that is closer to the door. So for me right now, that's my right hand. If I was turned around the other way, that would be my left hand. All right, staying in this nice strong stance with both ends of the band in your hand closer to the door, squeeze your belly, twist from your torso, and punch away from the door. Slowly bring it back. You will feel this in your arm, but you should also be feeling it in your abdominals. Now watch my hips. My hips are staying straight forwards, and the twist is happening in my torso. So it's happening from my abdominals here. If this is too much, you can always drop one end of the band and just do it with one instead of two. That's going to give you a lot less resistance. So nice twist. Again, notice hips are staying forwards. The twist is happening from the torso only without the hips getting involved. We'll do about 10 of these on each side, then switch and do it again. Okay, so about 2 sets of 10 for these press outs, about 2 sets of 10 for these twists. You can always change that up for what feels good in your body. As always, as many as you can do with perfect form and no pain.